Imagine a world where life-changing medications are within reach for everyone, not just the wealthy. That's the promise of a potential deal brewing between the Trump administration and pharmaceutical giants Eli Lilly and Novo Nordisk. A deal that could dramatically slash the cost of popular weight loss drugs and expand Medicare coverage. But is it too good to be true? Let's dive in. The Trump administration is reportedly on the verge of announcing agreements with Eli Lilly and Novo Nordisk. The goal? To lower the price of some of their weight loss medications to under $150 per month. This is a significant drop, aiming to make these treatments accessible to a broader range of people. And this is the part most people miss. The negotiated deals aren't just about lower prices. They also aim to broaden Medicare and Medicaid coverage for these obesity drugs, according to reports from the Wall Street Journal and Endpoints News. Think about it. Millions of Americans, particularly seniors and those with disabilities, could gain access to treatments previously out of reach. The core of the potential agreement, reported by Endpoints News and the Wall Street Journal, involves Lilly and Novo offering the lowest dose of their weight loss drugs, like Zepbound, Lilly, and Wegovy, Novo Nordisk, for that $149 monthly price. This price point is crucial because the high cost of these medications has been a major barrier for many. In exchange for this lower price, the drugs would gain coverage under Medicare. Currently, Medicare doesn't cover these drugs specifically for obesity treatment. They might cover them if prescribed for diabetes or heart conditions, but not for weight loss alone. Separately, the Wall Street Journal also reported that the Trump administration is exploring options with Lilly and Novo to sell some of their obesity drugs through the government's direct-to-consumer website, Trump Rx, scheduled to launch in 2026. This could potentially streamline the process and further reduce costs. Novo Nordisk has acknowledged constructive discussions with the administration in a statement. Lilly representatives, however, have remained silent on the matter. But here's where it gets controversial. Is this a genuine effort to improve healthcare access or a politically motivated move ahead of an election? It's a question worth considering. It's worth noting that this isn't the first time the Trump administration has pursued such deals. President Trump has previously announced agreements with other pharmaceutical companies to offer discounted medications through federal health programs or Trump Rx. He's been a vocal advocate for lowering drug prices to match what patients pay in other developed nations, a concept known as most favored nation pricing. This approach aims to ensure that Americans aren't paying significantly more for the same medications compared to people in other countries. He has previously announced deals with Pfizer and EMD Serono to lower the cost of medications through Medicaid and for in vitro fertilization, respectively. But why is this so important? Well, consider this. Most insurers don't cover obesity drugs. Doctors who prescribe these medications emphasize the critical importance of extending Medicare coverage and making them more affordable. Dr. Angela Fitch, former president of the Obesity Medicine Association, describes these medications as really life-changing for so many people, highlighting the challenges patients face in affording them at current prices. These medications, often GLP-1s, glucagon-like peptide-1 drugs, work by suppressing appetite, leading to weight loss. And while insurers often cover them for diabetes or heart conditions, a significant portion of employer insurance plans still refuse coverage for obesity specifically. While coverage is improving, with 44% of large employers covering these for obesity in 2024, up from 41% in 2023, according to Mercer, there is still a long way to go. Interestingly, the Biden administration also announced plans to extend Medicare and Medicaid coverage for obesity medications, like Wegovy and Zepbound, in November 2024. Under a proposed rule, the Biden administration estimated that 3.4 million Americans on Medicare and another 4 million Medicaid recipients would become eligible for these drugs starting in 2026. However, the implementation of this coverage hinges on the Trump administration finalizing the rule. This raises a crucial point. Could this potential deal be a way for the Trump administration to take credit for an initiative already in motion? It's a complex situation with layers of political maneuvering. So, what are your thoughts? Is this a genuine effort to make life-changing medications more accessible, or is there more to the story? Will these deals actually materialize and benefit those who need them most? And what impact will this have on the pharmaceutical industry and the future of healthcare in America? Let us know your opinions in the comments below.